Day, good day to talk budgets. So first, I just want to say that I am come at this from the lens of someone who reads a lot of budgets. I have several nonprofit clients, and so I work on some of these issues, but this is by no means a completely comprehensive overview of what's in the budget. So I'm going to hope that some of you will jump in with things that I have missed or things that you want to add in. Um, and so that can be a conversation. I am not the complete expert on all things of this budget, but I would like to, briefly ground us in some of the budget basics of how the state budget works. Some of you may know more of this than others, but I figure it's good to just start with an overview of the process. And then I'll walk through um, the FY27 state budget with four buckets in mind. I'm going to start this year with sort of the direct allocations to nonprofits because I think that's very interesting for a lot of nonprofits to see, who is getting direct allocations. Then we'll look at impacts for nonprofits workforce and sustainability, frankly. So it may be their reimbursement rates or other things that actually impact the organization. And then look at changes that were made that impact clients, whether that's things that made their lives better or worse. And so things that you may think about in terms of your ongoing work and whether your need will grow or have things improved. And then lastly, just sort of trying to think more globally around some of the housing and community investments that nonprofits may want to either look into working on in the future or which sort of globally make the state a better environment for our clients and ourselves. Then we'll try to think about some things that aren't included in the budget that either folks thought might be, and then there will be time to share at the end, but I'm always also happy for people to jump in and ask me questions as we go. So here is just the overview of the year. I like to make sure that people remember that the state budget is not something that just happens to us in June. It really is a full year cycle. And now that we're towards the end of the July, our poor state agency partners are already starting to create their budgets for the fall. And even though we have an election, they will still be putting together agency budgets soon. So the process starts then. Then there are certain points that are of interest. In November, there's revenue caseload and estimating conferences, which looks at how much the revenue the state expects to have for next year and how the caseloads for mandatory programs are looking. So mostly Medicaid, childcare, and the TANF programs. Then in January, the governor submits his or her proposed budget. And then that it goes over to the General Assembly for the House and the Senate to review it. And then again in May, there's another revenue and caseload estimating conference to look at how our revenues and caseloads are actually looking. And then the final budget negotiations happen. So for the FY27 process, we'll all remember that in January, third week in January, Governor McKee proposed his budget. And then that is for the year that just started this month, July 1st, and goes through June 30th of 2027. The House and the Senate reviewed it, and then the General Assembly approved it very early this year on June 9th. The enacted budget is the key source because it looks at the final appropriations. So whenever you're looking at budget documents online, be sure you're looking at the enacted version, not the governor's proposed version. And the governor did sign it on June 12th this year. Again, very early, it's election year. So in terms globally, the budget was $15.24 billion. That was almost $1 billion more than, oh, I have an M, but it should be, yeah, it was almost $1 billion more than last year. So $906 million more, which, again, it's an election year. They gave a lot of people a lot of things. This is just a breakdown of how the revenue side looks. I think it's really important to note, especially as we go into next year, that the most revenue that comes in is our general revenues, which is tax revenues. But there's also federal funds makes up 38% of our budget. And so when we have concerns about what's happening in Congress, that is the big chunk that could really impact the goods and services that we all use and our clients use and that run our budgets. All right, I'm trying to use two screens and I can't figure out which one works. Okay, and then the other point I just want to make as a grounding is that the budget is about funding and is the biggest um, priority of how we use our money, but the budget document itself also does make law changes. So when you're looking at the budget articles, the different articles reflect substantive legal changes to different pieces of law. So we'll try to talk about a little bit of those as we go. All right, so here are our four buckets that we're going to talk about. The first are direct appropriations. These are sort of the easiest to see that they impact nonprofits. The next are budget changes that affect either our staffing, our provider stability and reimbursement rates, and then decisions that affect people we serve, and then sort of more global housing and community investments. All right, so here is my four slides of who got direct appropriations for nonprofits or nonprofit delivered programs this year. I was able to find 39. I expect that there may be some others that are hidden, but these are the ones that were very clearly obvious in the budget documents. So 39 for a total of $13.8 million, which if you think about it is a pretty small amount of money for given our large overall budget. So you'll see in this list, I won't read it to you, but that there is a range of how much different nonprofits receive. A lot of legislators will tell you that they hate that this is how we allocate money to nonprofits, that we do it piece by piece, and that they would like to see a larger system overhaul of this process. But this is the process that we have right now. There were a couple new ones, Farm Fresh, which does a bonus bucks program, which provides like one-for-one incentives for folks who use their SNAP benefits to purchase food at farmers markets, mostly fresh produce at farmers markets, was a new allocation. And then there were two international organizations that work with international or refugees, New Bridges for Haitian Success and Oasis International, both received new allocations this year. The food bank did receive a much larger allocation this year with the SNAP cuts that are happening. I know personally that Ripen also receives other contracted programs. So this is not completely comprehensive, but gives folks a view. And then the State Council on the Arts is a grant, pot of money for grants, and so is the Senior Services Support. So those are not for the organization specifically, but for them to reallocate those grants out. So those are the direct lines that are mentioned in the budget in terms of giving folks an allocation. Then now we'll turn to the topic of where these impact your organization or could impact your organization directly in terms of funding or rates. So the first bit of good news is the Medicaid rate increases that were proposed by the Office of Health Insurance Commissioner. They have to do a review every other year for different social service programs. The governor had proposed rolling this out over 2 years, but the General Assembly made all of the rates that OHIC proposed effective October 1st. that include home and community-based services, behavioral health care services, children's services, and managed care. There's some managed care administration included in that. Um, this did not include the primary care rate review, which has gotten a lot of attention, but that is happening right now, which also includes in it the pediatric rate review. And I believe that report is due in the end of September. So that those folks, even if the report says they should get an increase, would not get an increase until next fiscal year. So it won't be during this fiscal year. There was a rate increase for infant childcare for childcare centers who provide infant care for the Child Care Assistance Program, got a 5% increase. And then a program for child care educators. So if you're a child care worker who works in a child care center, you can get free child care for your own children. And that program was extended for 3 years. And there was also state allocation for match dollars to draw down federal funds for home visiting programs. Um, this is really just about not leaving federal funds on the table in order to fund some of the programs we have here in Rhode Island. And then the Wavemaker Fellowship, I also thought it was notable to note that it is extended for another year because that is a program that helps with loan forgiveness for a number of professions that often employ or employ nonprofits employ. So, for instance, I know in home visiting programs or early intervention, folks who have PT or SLP um, can get their loans forgiven. And then turning just to the policy changes that affect clients specifically. So, with sort of a lens for lower income folks, but no, not necessarily. There was a refundable child tax credit, a new one that is in addition to the child dependent care allowance. So it will be $330 per child starting in January. It phases out at incomes of 100,000 for single or 125 for joint filers. It's estimated for this year to cost about 23 million. For Social Security, there's a age, you have to be retirement age and then under a certain amount of income to receive an exemption from Social Security taxes. They removed the age threshold for this year, which is costing about $3 million. And then there was an increase in childcare eligibility so that folks who are earning higher incomes can stay in the child care assistance program and also have their income increase over time without losing the benefit. This is really meant make to make sure that folks who are getting a minimum wage increase are not impacted and lose their child care assistance because we know that minimum wage is going up every year, and it's getting to the point where if you're a two-parent family earning minimum wage, you would not be eligible for assistance. So, for reference, currently, as someone a three-person family, so mom with two kids or two parents with one kid can earn up to 71,000 to enter the program, and now she or they would be able to earn up to $77,800 a year to enter the program and then be able to get a bump. For health insurance, the federal rules changed to eliminate a subsidy starting in January. And so Rhode Island put in $22 million for premium assistance to try to support those folks who are paying for insurance on the exchange, but are losing that subsidy. It's not full, but it is a partial subsidy replacement. And there also is a $26 million for hospitals to provide uncompensated care for those who are going to lose their health insurance, Medicaid, due to the federal changes. I should note that this is only for hospital uncompensated care. It would not be for folks who are getting care through other clinics or other places. We'll talk about that in a little bit, but just flagging that. But it is good that there at least is increased amount, although I bet if there are any hospitals on this call, they would say that the 26 million is not going to get them as far as they would like. There was funding to support the 988 crisis and suicide hotline, so that will continue. And then around long-term care, there was a funding 438 million for nursing facilities, which includes the rate review, and then also money for home and community-based services um, for certain tiers of folks living in assisted living. This is for pediatricians, PDPRN and Moms PRN is a program that allows pediatricians to contact behavioral health providers to help them with either children or moms who are having behavioral health needs. That was going to expire due to a federal cut, and that was sustained. And then there's a new law that was put into the budget, which will extend EI services beginning in May of 2028 for a child who turns 3. After May 1st, they can remain in early intervention if they're still qualified for services through September. So the idea is that a lot of kids turn 3 in the summer and they have a gap in services until September. And at age 3, that's a pivotal time period to not lose services. So they would be able to remain there. There's also federal funding to help support that change. And so Rhode Island's going to take a year to roll it out, but that will be a new policy. On the Rhode Island Works program, there is a small change that if you're the parent, one of the parents is paying child support. The way it works now is if you owe child support, you pay it, and most of it goes to the state to reimburse the state for the Rhode Island Works TANF benefits. This would increase the amount that actually goes to your children. Currently, only $50 for child goes to the family, and the rest is retained. Now it'd go up to 100 for one child and 200 for 2 or more children. So it didn't increase the Rhode Island Works benefit itself. It just increases the amount that can get passed through for those who have a parent who's paying their child support. And then RIPTA, I'm sure somebody on this call can do this better than me, but basically RIPTA was fully funded for this year. And they've reorganized the payment structure so that they should be sustained for the next several years. Were not funded because RIPTA has had deficits for at least 2 years in a row. That they did not fund them to the level where they can reverse the cuts that they had to make last year, but they are funded, so they should be whole and not have to make any further cuts. Anybody wants to jump in and correct me on that, feel free. All right, so those are my two sections on sort of things that directly impact nonprofits and then things that impact the clients. And so now I want to talk sort of more globally. Some of these are also things that impact clients, but we hear a lot about housing investments, and I was struck in reading the budget at how much of the housing investments that are still happening are really with ARPA funds, which is the federal funds that happened after TANF, after COVID. And so I just am trying to give a picture of this so you can see that next year a lot of these funds will be used up. So there is $2 million to work to try to remove barriers for affordable housing production and preservation. This is across a couple of state agencies, and it looks like it may be done through the home equity zones, the health equity zones. So I'm curious if anybody knows more details about that. And then just looking at these production investments, you can see that most of them are ARPA funds. So they're using the remaining ARPA dollars to do some housing development production, affordable housing, workforce housing, and then home repair and they call it community revitalization, public and community spaces, which begs the question, what happens next year? There's also $4 million to pre-fund the low-income housing tax credit, which is money that developers can get back at a pretty good rate to create low-income housing. On the supportive services side for housing, there is new funding of just 1.7 million for to support the shelters in Providence. And then again, there's a funding that is time limited because it's ARPA funding um, to look at homelessness assistance and supporting cities and towns that are providing homeless assistance. Some other sort of community investment pieces, the state has gotten or is getting in the process of getting, I think it's maybe gotten this rural health transformation grant. I think they're getting the first year of it. Um, this is a lot of money for the state, and it is to fund across 4 or 5 different state agencies to do all sorts of different programming around workforce development, technology innovation, health for rural residents, innovative access, and sustained access to care. The definition of rural seems to be very broad. Like, I think it's the whole state is considered rural. So I know that there are meetings that, Grace, you can correct me if I'm wrong, have already started or are starting to look at what that rollout is going to be. But my understanding is that will sort of start and then the RFPs may go out very quickly around that. Um, there is there are 5 bonds that will be on the November ballot. I'm not going to talk about all of them, but 2 of them are relevant here. I think one is around affordable housing, $120 million, and then a state preservation bond around preserving historic sites that are open to the public. I also wanted to point out that their library support was funded, so both resources sharing aid and then per construction aid. A couple other things that I just had to mention, even though they're not sort of nonprofit directly related. The millionaires tax was increased, but it was phased in and much smaller than what the proposals had been. But there will be about $22 million for FY27 um, in tax revenue. A lot of nonprofits worked on this for a long time. Um, so that number is smaller than everyone sort of hoped, but it will be a new tax rate for incomes for earnings over $1 million that will now be taxed at 6.99%. The following year, it'll be taxed at 7, and then after that at 8. So it's a 3-year phase in. And I'm curious about how they're doing the math on this because it doesn't start until tax year 27, and then people's taxes aren't due till the following April. So it must be that they assume some people will prepay to get them to the 22. Then there is funding in this budget to support HR1, so the SNAP and Medicaid changes that are happening now and in the future. So DHS is hiring a number of people just to work on increasing their communications and their processes to reduce their error rates so that we don't have to pay even more. And they created a new Office of Program Integrity to audit programs and application processing. Also, at the very last minute, our new speaker added in the creation of an Office of Inspector General. It's $1.2 million for a new 12-person office. It seems like a little bit of money for a lot of people. But that process has not started yet. It's not up and running, but I do think it may impact nonprofits because if you think about any state grants that people get, they may be subject to this process. And then there's the third bond I wanted to mention is a $55 million green bond, which is intended to support climate resiliency, 7 million for Narragansett Bay watershed, and then some money both for open spaces and preservation of agricultural lands. So if that passes in November, it would be available in the following year. Other items, the DCYF consent decree, there was additional funding to continue implementing the multi-year plan that is required on children's behavioral health. They will be able to add 6 new full-time equivalent staff members to work on that. And then all DCYF providers will be required to transition to fee-for-service Medicaid starting in next July. And there is $4 million to help the providers get ready for that. You have to have all sorts of systems that can track Medicaid billing in a way that some nonprofits don't already do. So that will be available to support folks as that rollout happens. Learn 365, which is the governor's out of school time program, was funded again for $2 million. And then there was a small amount of money for multilingual learners, both certificates for more teachers and dual language programs, which folks have been asking for a long time. The Hope Scholarship at Rhode Island College will continue for 3 more years through 2029. And the other scholarship program at CCRI is also continuing. This is my small list of what was not included. I'm curious to hear from all of you what else you think. Um, but certainly there was no rollback of the clean energy goals, which the governor had put in the budget. So that I think for a lot of people was good news, but it did mean there were no reductions in energy costs. There was no bottle bill, which folks have worked on. There's no out of school time funding and no school meals for all. And then big things, I'm going pretty fast, but let's see, are there any questions? Um, doesn't look like it. So the other big things that have been in the paper that I wanted to be sure people are aware of. The school funding formula was just increased incrementally. They do that every year. As the Rhode Island Foundation report noted, it's time to update the school funding formula. So the General Assembly did not take that on this year, but they did include a reporting requirement that RIDE has to look at the budget from a comparison with what the Blue Ribbon Commission suggested from the Rhode Island Foundation and come up with a comparison. And then also there was legislation that said that there is a commission to look at this. So I expect that next year there will be a lot of conversation about the school funding formula and how to improve it. We know that districts are extremely underfunded for kids with special needs, and they're seeing growing need for those populations. And so it's something that needs to be re-examined. There also is some concerns around equity and how it is distributed. So I think that's a big thing that we will be hearing about next year. SNAP funding, this is something that is not in the budget, but well, a little bit of it is in the budget. So in FY27, we will have a new SNAP administrative cost. Um, it's unclear how much it will be. The Congress right now is talking about maybe pushing it off, but it doesn't seem likely that they're going to do that. So we will have to pay about $15 million, maybe a little bit less. The budget actually has about 9 million in it to pay that administrative cost. Currently, the feds pay the entire administrative cost. So this is a new cost that Rhode Island will have to pay. And then the other huge piece is that we will have to pay a percentage of the benefit amount costs, um, which Rhode Island is looking at a $51 million new cost just to provide the benefits for people who have them now. So all told, that's $67 million of SNAP costs that we didn't have this year. Um, I'm not sure what the plan is around how to get to there to get to that amount. And then even more concerning is the Medicaid funding. Those while the SNAP cuts have largely gone into effect, the changes in terms of eligibility, the Medicaid changes have not, but they do start in October. I think people are starting to get notices. Um, and that we will see a savings, if you want to call it that, of $54 million for people who are losing their Medicaid. Um, but about 33,000 people will lose it. And that will also come with federal matching funds, a loss of 276 million. If you remember, I said how there was 26 million for uncompensated care at hospitals. So those are folks who go into the hospital and need emergency care. So the hospital will get reimbursed for 26. But if we're losing 276 million of federal funds for folks, it seems like a mismatch in terms of what the need will be. Um, there was some proposals around trying to increase that amount this year that did not move forward. So I think this will be the other big issue is how we're going to support and help um, folks who've lost their Medicaid coverage and what happens when they come in the clinic or hospital doors, um, starting really in January mostly. Okay, so those are my overview slides. I'm happy to go back, and then I want to just flag for folks where you can find more about all of this. If you go to the General Assembly's website, the this is the homepage. The budget information on the left includes both the budget articles and budget documents. And then the House and fiscal staff have really the better summaries. So that is the place to go. Think the House summaries are really good because they break it down by topic area. They have special sections for housing and healthcare and education. Um, just remember to be sure you're looking at the enacted budget, not the governor's proposed budget. The other things, I felt like there was not as much this year in the news about any of these issues, but often you can read about them with, Boston Globe or Ted Nesi for the WPRI or the Public's Radio. This year, it was very light on details, but those are places that I would recommend you follow in the future. Kathy Gregg from Projo, PPN, Echo RI often has good environmental updates, Public's Radio. Okay, so what did I leave out? I'd love for you to come off mute and tell me or ask me questions.
I don't have a question, but thank you so much. I very tuned into the disability space, so it's nice to hear some of the other organizations and what they're working on.
Great. Thanks, Grace. I wonder if you have anything you would share about the DCYF budget. I know it was pretty fully funded this year. Did you feel like it was adequate and
I had nothing to do with the DCYF budget.
no,
I
yeah,
could
you didn't
talk to you
follow.
about the Medicaid rates, and those were fully funded.
Okay.
So we're excited in
Yes.
getting those implemented through the state agencies, but I didn't work on the DCYF stuff, unfortunately.
Okay. No problem. Me neither. Any other things that people wish I'd talked about? Oh, Robin.
Yeah, I just want to say thanks for breaking it down for us. I've been getting it in so many bits and pieces. It was nice to really get it all in kind of one sitting, all the things that I'm really concerned about or, interested in. So thank you for doing a nice job with that.
Well, thank you. I appreciate it. All right. Well, this is a quiet group. See, often people will come on and tell me all the things I left out. I did not go much into education funding. Um, the big news right now is the moratorium on charter schools, which happened, and they're suing the state. I read in the paper this morning. So I think that will be interesting to follow to see what happens with that. Um, and there's another bond around URI facilities again. Um, and then I forget what the fifth bond is. Wasn't something that I thought was nonprofit related. Um, but I think really the biggest thing for me is the what's going to happen with the Medicaid pieces. I would point to people that EOA is doing two webinars next week on the Medicaid changes, one on the 5th and one on the 6th. If you go to Cover RI, you can sign up for those. I'm very curious to see what they are sharing because I do think they are sending out notices for populations of folks who are going to either have new work requirements or lose their eligibility. The good news from at least from my nonprofits that I work with is children and mothers are pretty protected so far. So if you're working with fee-for-service programs where the children are covered and you get reimbursed through them, then they should be fine, knock on wood, at least for next year. Um, I guess the challenge will be is if the state has this huge hole and isn't sure how to fill it, if they have to make eligibility changes. But in terms of what um, the federal changes are right now, Rhode Island does cover all kids and cover prenatal moms. And so I think that's the good news is most of the people who are impacted by the changes are the expansion population or folks who were sort of late to the party to get covered, or the single adults. So I think there will be a lot of confusion, and we worry that what will happen to the families too, and there's so much confusion all over the place. But the families with young children shouldn't have increased work requirements, shouldn't have shorter renewal dates, and should be fine for at least the short term. No, thanks, Robin. Yes. And I would also point folks to Ripen, who's going to be doing more education too and trying to get people on board around the healthcare changes. So I guess the last thing I would just say is if anyone is interested in hearing from our gubernatorial candidates, uh, I am, two of my clients are the Right from the Start campaign and Children's Friend, and we are hosting a gubernatorial conversation next Thursday at Children's Friend on Berkshire Street. We have 4 of the 6 confirmed candidates for governor who are going to come talk about all things early learning. So not just childcare, but WIC and home visiting and Head Start and pre-K. So we're interested to hear what the platforms are around that. For we have two independents running, two governors running, I mean, two Republicans running, and two Democrats running. So it is sort of more than usual. So please feel free to come and hear them. All right.